Dear students, welcome back. In the previous session, we have discussed about the inguinal triangle. Now, in this session, we are going to discuss about the applied anatomy of anterior abdominal wall. So, while examining the abdomen, the knees and hip must be flexed to relax the abdominal muscles like this. This is the position. This position is also called as crook lying position. Okay, now just we have to refresh the functions of this anterior abdominal wall muscles. Normally this abdominal wall muscles support the abdominal viscera by providing an firm elastic support for the abdominal viscera against gravity. Out of these abdominal muscles, such kind of support is mainly done by the oblique muscles, especially the internal oblique muscles. Okay, and these muscles also helps in expulsive acts like micturition, defecation, parturition, vomiting, etc. Okay, this is one of the most important actions of the abdominal muscles, and it also helps in forceful expiratory acts. Mainly the external oblique muscle depress and compress the lower part of the thorax, producing forceful expiration. Such kind of forceful expiration occurs during coughing, sneezing, blowing, shouting, etc. Okay, these are all the very important functions of the abdominal wall, anterior abdominal wall, and also these muscles are also used in the movements of the trunk, like flexion of the trunk or lumbar spine is brought about mainly by the rectus abdominis, and lateral flexion of the trunk is done by one-sided contraction of the oblique muscles, and then rotation of the trunk is produced by the combined action of the external oblique with the opposite internal oblique muscles. So these are all the functions of the anterior abdominal wall. So why should we refresh these functions here means, so due to lack of exercise, the tone of muscles of the anterior abdominal wall decreases, leading to protrusion of the anterior abdominal wall. This is called as visceroptosis. What do you call visceroptosis? So that means here the abdominal organs are downwardly placed than the normal position. Such kind of thing is called as visceroptosis. So here optosis itself, the term defined here is any organs are displaced downwards, then it is called as ptosis. So here visceroptosis means it is the prolapse or sinking of the abdominal viscera below their natural position. So such kind of thing is going to happen if there is any lack of exercises. So what happens during lack of exercises? The tone of muscles of the abdominal wall is going to decrease, leading to visceroptosis. Okay, and this anterior abdominal wall is punctured for various procedures like surgeries of gallbladder and vermiform appendix, etc. For that, they are going to puncture this anterior abdominal wall by giving some incisions. So there are different kinds of abdominal incisions. So in that, the first one is supraumbilical median incision. So that means, so this is the incision given supra, that means above umbilical, supraumbilical, in the median line, along the median line. So then such kind of incision is called as supraumbilical median incisions. This is given through the linea alba because it is having several advantages as being bloodless. So blood loss is very much minimal here, and safety to the muscles and nerves. Okay, but it is having one problem, that is post-operative weakness is present at this area, through which a ventral hernia can be takes place. So ventral hernia we are going to discuss in detail about this hernia. Okay, next, coming to the, though it is this incision is having so many advantages, but it is having one disadvantage, causing post-operative weakness of that area, leads to ventral hernia. Next, another one is the infraumbilical median incision, same type of incision which is given below the umbilicus, then it is called as infraumbilical median incision, which is safer because the close approximation of this rectus. So we have seen, we have discussed the rectus abdominis muscle at the lower end. So the rectus abdominis muscle is like this, that means it is having the close approximation of recti is present at this area, which prevents the formation of any ventral hernia. Okay, this is another kind of incision, and next we will see the paramedian incision. So this is the paramedian by the side of the median line, that is linea alba. So right here the incision is present on the right side, so it is right paramedian incision through the rectus sheath, or very much useful than the median incisions. Okay, the rectus muscle, so here in this incision the entire rectus muscle is going to retract laterally to protect the nerve supplying it from any injury. This is one of the important use of this paramedian incision. So, and another kind of so in this case also there is a subsequent risk of weakness and of incisional or ventral hernia or minimal in such kind of incision. Okay, so another kind of incision, that is called as suprapubic incision. The suprapubic incision is done in the lower abdomen above the pubic bone. Okay, normally such kind of incision is done for any bladder or prostate gland removal. Okay, so these are the types of incisions seen on the anterior abdominal wall. Okay, and next incision for appendectomy is given at McBurney point. This point is defined as a point that lies 1/3 of the distance laterally on a line drawn from the umbilicus to the right anterior superior iliac spine. Classically, it corresponds to the location of the base of the appendix, that is the point. Here they have given the incision for appendectomy. Okay, these are all about the incisions related to the anterior abdominal wall. In the next thing we are going to discuss in this applied anatomy of anterior abdominal wall is the hernia. Hernia is a protrusion of any of the abdominal contents through any of its walls. So through any of its walls, this is called as external hernia. Sometimes the intestine or omentum protrudes into the no entry zone within the abdominal cavity itself. Such condition is called as internal hernia. Here these are the normal areas of hernias. So there are different types of external hernias. One is the epigastric hernia, umbilical hernia, para-umbilical hernia, and this one is incisional, direct inguinal, femoral hernia, and indirect inguinal hernias. So there are different kinds of hernias which can be occurred through the abdominal wall. So here you can see this inguinal hernia, how this intestine is coming out of this abdominal cavity. So because of this weak abdominal layer, so some part of the intestine is coming out through this inguinal area called as inguinal hernia. Okay, this is femoral hernia. So this is epigastric, and so due to causes of any surgical incisions, because of that weakness of that area causes some protrusion of the abdominal contents here. So, and this one is the umbilical, because of the weakness at this umbilical area, so the organs are protruding through this umbilicus. So these are all different sites of hernia in the anterior abdominal wall. Okay, now what hernia consists of? Why such kind of protrusion is happening? What are the contents of this hernia? Now we will see. Yes. So this is the parts of hernia. This hernia consists of sac. So this consists of sac here, and it consists of contents. So these are the contents. So for example, this is the loop of the intestine, that is the contents, and also it is having coverings. So the sac is covered by the coverings here. So the hernia consists of a sac and its contents and coverings of the hernia. Okay, so the sac implies the peritoneum, protrusion of the peritoneum, and the sac consists of a neck. Okay, it consists of a neck. Here you can see the neck, and then the narrowed part. So this one is the narrowed part of the sac, and a body. So this body is the bigger part. So this is the parts of the hernia. Hernia consists of a sac and its contents, and this contents and the sac are covered by coverings. Okay, and this comprises a neck and a narrowed part and the bigger part. Okay, here the contents are mostly the long mobile. So here if you can see the content, which one is long and almost mobile. Normally it is the contents are normally the small intestine or any large intestine or any other viscera. So commonly we can see the intestinal part, and coverings or the layers of the abdominal wall which are covering the hernial sac. So the layers of the abdominal wall form the coverings. Okay, so these are the parts of the hernia. Okay, so this is another condition called as exomphalus. This exomphalus is the weakness of the baby's abdominal wall where umbilical cord joins it. So this is the area. Okay, so This weakness allows the abdominal contents to protrude outside the abdominal cavity when they are having a loose sac that surrounds the umbilical cord. So such kind of thing is seen in baby's abdominal wall. Okay. Next, so what are the complications of these hernia means? It causes irreducibility. That means in the beginning the loop of intestine herniates out but goes back to the abdomen. But sometimes what happens, the loops goes out but not return, leading to irreducible hernia. Okay. Next one is obstruction. The loop may be get narrowed in the part. So here, if the narrowed part is increased, so that the contents of the loop cannot move forward, leading to obstruction. So whatever the contents which are moving inside the loop will not move then. So what happens? It leads to obstruction. Next one is the strangulation. When the arterial supply is blocked, then the loop gets necrosed. Okay, so because of this narrowing, the blood supply, the arterial supply is blocked to the loop, then the loop is going to necrosed. Okay, so these are the complications of this hernia. So now we will see the types of abdominal hernia. As I have mentioned that there is an internal hernia and external hernia. Normally internal hernia occurs inside the peritoneum, that is no entry zone of peritoneum. Mostly this internal hernia occurs in epiploic foramen, that is opening into the lesser sac. So this one we are going to discuss in the peritoneum. Okay, next, different types of external hernia I have mentioned: umbilical, paraumbilical, femoral, inguinal, epigastric hernias, and also divarication of recti, that means separation of rectus muscle, incisional hernia because of incisions. So in that area, weakness of that abdominal wall causes the hernia. And then the lumbar hernia. This lumbar hernia normally represents the posterior abdominal wall. So it is referred to posterior abdominal wall. We are going to discuss here itself. Okay. Now, umbilical hernia. So this is congenital umbilical hernia due to non-return of midgut loop back to the abdominal cavity at the area of umbilicus. Okay, leads to umbilical hernia. So this one we can see in the infantile type of umbilical hernia. Due to weakness of umbilical scar, a part of the gut, okay, may be seen protruding out. So this is the weak umbilicus area. So this such kind of, here the loop of intestine, this is a part of gut which is protruding out. Okay, it disappears as the infant grows. Okay, next one is the paraumbilical hernia. So loop of intestine protrude through the linea alba around the region of umbilicus. So this is called as paraumbilical hernia. Next, another one is called as the femoral hernia. So this is femoral hernia, and in this pic only we can see the inguinal hernia also. Femoral hernia occurs more in females due to larger pelvis. Okay, smaller blood vessels and larger femoral canal. So the females will have larger pelvis, smaller blood vessels and larger femoral canal. So because of this, the hernia is taking place here. Okay, this is the femoral region. Okay, so its neck lies below and lateral to the pubic tubercle. So here this is the neck part, lies below and lateral to the pubic tubercle. So surgery is essential for such kind of hernia. Next, coming to the inguinal hernia. So this is the inguinal hernia. Protrusion of loop of intestine through the inguinal wall or inguinal canal is called as inguinal hernia. So we have seen the inguinal canal. Through this inguinal canal, some part of the intestine is protruding through this inguinal canal, and it is coming out through the superficial inguinal ring. So this is called as inguinal hernia. Okay, and when the protrusion occurs through the deep inguinal ring as well as the inguinal canal and superficial inguinal ring, this will going to descend into the scrotum, then it is called as indirect or oblique inguinal hernia. So when these contents are moving like this down, so this is called as indirect or oblique inguinal hernia. Okay, when the protrusion occurs through the weak posterior wall of the inguinal canal or inguinal triangle, that is called as triangle of Hasselbalch's, the hernia is called as direct inguinal hernia. So this direct inguinal hernia occurs in most of the older people because it is having wider neck of hernial sac. Okay, normally this indirect inguinal hernia commonly occurs in male infants, children, and has a narrow neck of hernial sac is present here. Okay, so this is about the inguinal hernia. So now we will see this inguinal hernias in detail. In that, the first one is the direct inguinal hernia. So we are going to see now this is the direct inguinal hernia. So this direct inguinal hernia occurs through the posterior wall of the inguinal canal. It occurs through the Hasselbalch's triangle. As we know that it is bounded by the triangle is bounded by the inferior epigastric artery and lateral border of rectus abdominis and inguinal ligament. Of course, this area is divided into medial and lateral parts by the passage of obliterated umbilical artery. Now we will see the coverings of this lateral direct inguinal hernia. Okay, most of the inguinal hernia is occurred on the lateral aspect. So which is having the coverings of this one is the extraperitoneal tissue. Here you can see this extraperitoneal tissue, and then fascia transversalis. Next one is the cremasteric fascia, and then external spermatic fascia. Okay, here we can see here external spermatic fascia, and then the skin. Okay, so these are all the coverings of the lateral direct inguinal hernia. One is the extraperitoneal tissue, and then transversalis fascia, cremasteric fascia, and then the external spermatic fascia, and then as we know that this cremasteric fascia and external spermatic fascia are the coverings of the spermatic cord. Here the cremasteric fascia normally constituting the cremasteric muscle, and which is made up of some muscle loops. And this external spermatic fascia is derived from the external oblique aponeurosis. So here you can, this is the continuation, and then the skin. Okay, these are all the coverings of the lateral direct inguinal hernia. Here we can see this is the loop of the intestine which is descending through the lateral aspect of the inguinal triangle. So all these contents are descended like this. Okay, because of this hernia. Next one is the medial direct inguinal hernia. This medial direct inguinal hernia is also consists of extraperitoneal tissue, fascia transversalis. But on the medial side, normally this is a very rare condition. Posterior aspect of this triangle is supported by conjoint tendon. So that one is also taking part in the coverings of the medial direct inguinal hernia. As usual, the external spermatic fascia and the skin. So this is about the direct inguinal hernia. Next comes to the indirect hernia. So this one is the indirect inguinal hernia. In the indirect inguinal hernia occurs due to partial or complete patency of the processus vaginalis, that is an invagination of the peritoneum. It may descend into scrotum. So here you can see, so the loop of the intestine descended into the scrotum here. Okay, so the coverings here are the extraperitoneal tissue. Again, this forms the extraperitoneal tissue, and the internal spermatic fascia, and then the cremasteric fascia. So this one is the cremasteric fascia and internal spermatic fascia. Okay, and then external spermatic fascia. This one is the external spermatic fascia, and finally skin. So these are all the coverings of the indirect inguinal hernia. Okay, so this is all about the applied anatomy of the abdominal wall. Thank you.